August 6th when I had my biopsy for the lump that I found in my neck. So that's when I first found out that I had it.
Okay, what kind of cancer did you find out you had?
Hodgkin's lymphoma.
Okay, would you explain what that is?
You want to start having, you set us with the conclusion. Especially your prostate examination, you elicit that conclusion from the witness. So if you want the witness to conclude that they're biased, or I think you want the witness to conclude, for example, you want the witness to conclude that they don't know whether these additional immunologies for example. The counselor school that Chris was approaching to. And then all the time that Chris has been with the counselor, Chris has been approaching to. Well, then it would be what the prosecution wants to bring across the point that, well, that counselor doesn't know everything they need to know about Chris. But instead of saying, you don't know everything there is to know about Chris, do you? You don't get into that's the conclusion. Instead you say, you're not with Chris all the time, are you? There are times that you're not with Chris. You could be with you only in school. You can with you after Chris is with you overnight. You know what Chris does at the same time. So you slowly, there's a witness that, no, I'm not a witness. No. And then you say, so you don't know everything you know about Chris. Now, the witness makes a conclusion, and the prosecutor makes a conclusion, but you just didn't make a conclusion on the first.
I was listening to something, I love that witness that we saw also. I've got another here about slow down. I don't remember specifically why I said that. I like that. I won't say that with everybody. The hardest thing to avoid. You got times you're worried about over here. You got all the things where make sure you get in. You don't get anything. Next thing you know, you're doing one time right now. It is. Prosecution presentation, direct. Good questions. My note here says better pictures of. On the inside, I don't know if it's correct or not. That was something that I appreciated on that side.
The defense do it pretty quick. We're at the third minute. So try to, how much time do you have to wait?
I think the defensive witnesses, the first one was 2 minutes, 27 seconds.
Okay.
Second one was 50 seconds.
Okay.
Third one was 2 minutes, 11 seconds.
How much time are they allowed?
30 total. 30 combined.
They're allowed half, 30 minutes total.
Inside, that's what it was.
Right, how much do they take into the paper?
About
5 minutes.
One six is the time. And that probably was probably you sometimes there go slow. We can and so that so I think probably would use more time. And then the cost can go quick. How much does it cost?
for the bank of the company.
For the prosecution and the defense?
1 minute, 12 seconds for the first one, 2 minutes, 57 seconds for the second one, and 2 minutes, 50 seconds.
And how much time do you allow?
20 minutes, 12.
And how much time do you use? Roughly 1/4 to 1/2. That's a lot more time. Don't lose track of the time. And realize you're down a lot of time. Don't focus so much on what you've already prepared. Try to have a concept in your mind of what you want to accomplish. And then just trust yourself to, all of you have the ability to do it on your own without any kind of, so allow yourself to free think and free do it. Yeah, don't be like, keep your bond and keep your value. Because, and then, part of preparation is you have only one or two things in mind that you want to accomplish. You want to, and that's what you spend your time doing, is creating your guess that gives us another point. It's so funny that Sean called Chris a mom. Is that right? Or Chris called Sean. But that's the point. I got lost. Who cares? And so be careful on what's essential and what's not essential. And so all of a sudden we're spending 20, and we got a 1 minute 12 second cross-examination, and we're spending 30 seconds on this one. That's probably that's just so focus on it. Don't let your focus get caught off track. Stay on track, stay on focus, and do the general thing. And what was the example? I said, I was supposed to be judged today, and I said, all of that, I'm always suggesting, so I didn't want to do it. I thought I wouldn't be able to do it, but a good job at it. But it ended up being enough to get the ball. Even the check, there was many times in which there were questions that called for speculation on the witness didn't have any knowledge of. That's okay. You should be sure of that. And I think if I'm right, that's probably just the question the way I go on in competition, I think that's an important part of the important component of getting good scores is having an examination. So like there was 2 objections. That's what it said. Did you have one? Yeah. Yeah.
Was there an exhibit C? Okay, yeah, I didn't know. That's what I was asking. I knew you brought it up to the.
Yeah, they were already marked.
Yeah, it's missing from this. It went A, B, C, and then E. Was there a D?
There is one.
But you all did that. You brought it up to witness. So you didn't want it in. Okay. Okay. There was one that you brought something up, had a witness lay foundation on it, and it was never asked.
I think that was the witness's deposition, the statement that they made earlier.
That's something you might want to. Yeah.
Which was rather than how the jury, some judge was looking out there, here's the deposition for such and such day, here on this time, that's it, and now you're coming to this day. So is what you said that day true, or is what you saying today true?
Well, one of the cases that we got
And then, for example, I just consider about that. Now, if the word counterfeit written on the dollar bill,
That's not what we were wondering too.
yeah, so explain to you that if the police are not, juries are going to go, well, who's the other person? You know what I mean? So talk about it. Who wrote counterfeit on it? Who's the $1 bill? You know, so converse with your witness about your business. Explain forward.
Yeah. You're going to use up a lot of your time laying a better foundation for that. You're going to talk to the officer. Is this the condition in which you found the spill? No. What's different about it? In normal, they're going to say, well, it wasn't in this bag. There wasn't this evidence case. I take the bag up. What's been changed? Well, that's been cut open. It's been resealed to crime lab. Okay. I mean, you got to show chain of custody on a lot of those things. Say, no, I wrote counterfeit on this so that it would not enter circulation again as you that get that in. Okay. So that's kind of like that. Slow down, that's a good way to kind of get your bearings. Just slow down, do those things you know have to be done, kind of get those out there, do the procedural things, and then worry about trying to, get a key thing out of the witness. But get the procedural things out of the way first. That means you know what you're going to do on that. And then if the witness trips you up, then worry about that. But get the little things out first that you don't have to worry about. You know, okay, I've got to get this done. Fine. Get that done, and then worry about getting that one thing or question to the other witness and come across. But get the little stuff first, because that's what's going to win the competition. Yeah.
Well, I think that we want to get through, go through all the rest of the individual reviews on that. We're getting a lot of fees on that. not that it's a bad job at all, I think it's wonderful, but, the only criticism I have was for something to come back out there. You be careful, I think, to answer question. It is difficult, I think, to be correct, you have to ask, but Daryl, what do you think? But think of it as, you know, you're helping your witness perform and explain their looking at. On the defense, I had good questions, good take, you're a little fidgety on that, I can't remember if it was you again, did that one, we did this, and then one on third. Okay, you, kind of, we're a little jittery on making around a little bit, try to, that's hard thing to avoid. The other thing is don't read too much off the top. I know that's hard to do, but, first of all, look up, address the witness, or address the jury if you're trying to make a point. You know, you don't have to look at the witness. If you really want to get the jury's opinion, look at the jury. On a specific question, you want to understand. It doesn't matter, okay, very good. On the cross-examination on the first defense witness, actually on the direct, the defense on the first defense witness. I had a witness, good faith, good knowledge, on the defense or direct examiner. I had a better place to most, when he did a pretty good job. On the prosecution side, again, very engaging. There's a most engaging of the presenter today. Quite honest. Still a little choppy there, though. Got to work on that. Very emotional. And good enough. Very much easy to understand. I'm sorry, I'm running through this fast, but I know we've gone over a few minutes to talk about this. On the second witness, I had a little bit of a good job, but I haven't heard about hearing. On the defense direct, good posture, good taste, a little more emotion. Get into the case a little bit more, engage the witness, engage the jury. On the prosecution side, on the other one, I thought it was good to put the witness on that, but you got back up and you took it too hard, in my opinion. It's good to put the witness when you think that you point out the, we lost on what I'm talking about here.
That's generally on the cross.
Right, right. That was on the cross. I think that was about the word to draw that. And I thought it was okay to bring out the cast there to keep their character. You get the impression that they're not being truthful, but once you've done that, you don't have to go back up and make the point again. So it's good to put it, don't put it too far. This is the only point I've got. And I thought a little faster on that presentation. You have to slow down. On the final defense witness, on the witness, let's just do the job. I have difficulty hearing that witness also. And that witness got a little mixed up on their back and one of the other witnesses. We got mixed up on gender a little bit. On the direct, I thought you did a better job on doing the direct than you did on the cross. You did get into a leading question situation there, and I had a hard time not laughing because there was an objection, and before the judge ruled, you restated the question, and the judge told you to try it a different way. And a different way to try it was even more leading, I thought, the first time. So, and knowing the objective then, I thought, well, you got to stand up and object again, just because the judge told you to do something, don't shut down, you got to keep listening. I thought there should have been another objection there, actually. Other than that, I thought you had a great patient on that one. Good job. On the prosecution side, on that last witness, I thought you did a good presentation on the conflicting testimony. Good attack on the witness. I thought that was a good thing. Good emotion on that one. Just a little of that. Closing argument on the plaintiff or on the prosecution. Good emotion, good conviction, but a good argument for why we have done a good job of presenting the case, laying it all out there for the jury, kind of summarizing it real well. Your problem was you're going over that, and you're not, and that's what's supposed to be done. You know, everybody got problems with that. I'm not sure everybody's going to go on with that. good side, good volume, that's one big thing. You got to be loud enough that everybody can hear you. You don't want to thunder up. That's a good job on the volume and the tone of your argument. Again, you rely on it more than anybody else, I think, and you got to break that habit. Other than that, I thought everything was real good. I had a hard time differentiating very much on the score between the systems, unless they're all fairly close.
Yeah, if Chris and Sean in the house, they could take $20 bills and start it, and go through the night. Are they the body plate, or is it just the making of the body, and they just try to yeah, aspiring to make with purposes to the cross. So if Chris and Sean are making this stuff, you would be checking it out, like downloading MP3 files, or it's down in front of the computer, and they use the computer, and the computer produces counterfeit money. And then they just start, they don't bother to use it. Is that not?
Yeah, but they probably can live in those around it, it's not really long, so.
I just got some questions that wasn't clear. Did Chris have to take $20 bill? Do you have any money that Chris has?
I think it's improvement in getting space, it doesn't matter, it's Chris for nothing. Because there's the other agreement, all the actions are equal for everybody. Yeah.
Okay, was there any conversation between Chris and Sean that they use this money? We talked about this agreement with you guys.
It doesn't have to be spoken to, it makes business, I know it's saying, you don't have to actually talk. I think it's like the other, like for instance, I think the asset, Chris going over to Sean's house, and showing Sean how to do it, that would be the initiative.
So that,
Yeah.
so is that true that if Chris shows Sean how to make money, and then Sean on her own goes out and makes money expensive, Chris still be on the crime?
Yeah,
Chris still will crime in that?
it doesn't matter, it's still up to the point.
Now we're in a trial. This is what we do, this is what we try. To get the prosecution, I would admit that they never caught Chris passing anyone. They caught Chris without any knowledge that Sean was probably passing money. All right?
The money that Tom spent is when he took it.
It was. When? They say that this $20 bill was the one that was made when Chris and Sean let it out. Who said that? So this $20 bill is the same one that was used on Chris in the house. Was this the same $20 bill that Chris and Sean made the day they were in the house?
Never made it together.
They never made it together? No. Yeah, you know, the prosecution said it was the same $20 bill.
It was the same $20 bill that was used at the, store. I mean, it was one pass, and Sean was one pass.
Did Chris make this a shot?
Well, according to the,
Well, I mean, yeah,
So, but it wasn't, do you really want Sean, or do you really want Chris to say, I didn't make any counterfeit money, I never knew any of this stuff was going on, because you've got Sean testifying against him, and Sean is credible to a point. I mean, you want your witness, your defense witness to say, I didn't have anything to do with it, or do you want your defense witness to say, okay, I was part of this making the money that day, I never said it was spending this money, I never spent this money myself. Sean officer's responsibility. And I want you to tell me why I should find you guilty of this charge and why he should be held accountable for what Sean did. You know, and he may be guilty of sin. But you wanted to point out that it's Sean's responsibility and Sean is acting on her own. If you want to explain more, no, there was an agreement, this is what they intended to Sean, but now on her own acting as a man.
Yeah, keep in mind, we don't have any idea what the material says, so.
That's
You
what
know,
I
for a blank slate, you got it right on that.
Yeah, and I want to know, okay, what about the $20 bill? This is the only one you got. This is the only one you can tie with Sean and Chris. What did Chris got to do with the $20 bill? So it all boils down to one piece, you know, this $20 bill, and what Chris had to do with it. So, okay. Judge.
I don't think I can see you have to be speaking.
Did you have any questions about it?
Next time you can put it that way, so that I'm not on the screen or
Only one other comment, I guess. People sit at different places when they were doing their presentation, and the only comment I had to say, I'm not going to keep what choice is made, but keep in mind when you make that choice, what effect you want to have. Are you trying to, what do you want the jury to get out of what you're presenting? Do you want them to be focused on you, on the witness? Do you want the witness looking at the jury or looking at you? And think about that when you're deciding where you're going to stand and how you're going to move to get it all around the courtroom. Because here's your audience, and you got to listen to them and think about them about everything you do. Other than that, I don't think I have any other comments other than you got to see what it's done.
So would you say Chris is in prison? Was Chris over his time? Yeah. Oh, he did, definitely. Yeah, he was over his time, prison, and he was no proof. Well, he's guilty.
Good luck, guys.
All right, good luck.
In the long term, what happens with radiation therapy is that it affects how the bones and the muscles grow. So that in the area where you've got radiation, say for example, when Stephanie grows a little bit more, that area may not grow as fast as the other area. So, one may notice a slight difference in the size of one neck on the other side. And then the other one that we'll be watching out more carefully for Stephanie is that there was some radiation therapy to her thyroid gland. And so sometimes the thyroid function can be affected much later on, and so we'll be watching for that.
Okay, what happens after the patient receives both chemotherapy and radiation?
Well, when the treatments are done, we talk about completing the protocol or the prescribed treatment for that particular cancer. And after we're done with that, then we do a complete evaluation to see if there's any evidence of cancer left in the body, which Stephanie just completed. And let me just check her chart here, because she just recently had that evaluation, and it showed that she doesn't have any evidence of cancer in her body now. So she is what we call off therapy, and so now she will be followed very closely in the clinic, and we'll be looking initially to make sure that the cancer doesn't come back in other places, and then long term we'll be looking out for these long-term effects.
Will she have to take any prescribed medicine now, or is she all done?
Let's see, she's on any medications right now. I don't think, unless she's on, no, I don't think she's on any medications right now. And I think she may be done with them all. I kind of call it, when they have their off-therapy workup, it's sort of like you find out all the results, and then you have the official pill-flushing ceremony. Get rid of all those pills, because it's good to be over.
Okay, what kind of attitude did you notice Stephanie had throughout the whole thing?
I just adore Stephanie. She's a really neat young lady, and she had a really positive attitude. She had a lot of spunk, and I really appreciated the self-confidence that she had. I remember when her hair first fell out, she came to clinic, had her scarf on, and she just, she sort of did one of these with me. She pulled it off, said, look what happened, and she showed me her head, and she just, she probably didn't share, I don't know that she shared any pictures, and her hair was gone. She just was beautiful with having hair. Her face was so pretty, but she just was real confident in dealing with the side effects, because that was a hard one. When you think about being in junior high and a teenager and having such a different thing happen to you and being so singled out, I think she had a lot of grace with the way she was able to cope with it. She had very strong support with her family. She was really able to talk to the doctors and the nurses and tell them, what helped her, what didn't help her, what she liked, what she didn't like, and that's real good for a young teen to be able to communicate well like that to the healthcare professionals, because not everybody can. Some teens might go through it just like anybody, and everyone's different. But Stephanie just seemed to have this real, I just have to call it confidence. And I think she really showed as she went through this, and she had side effects that she had to cope with, but overall she had a really good attitude.
So you met with her mom and dad? Did you meet with her brother or sister?
I met her brother. I don't think I ever met her sister. Her brother came with her to the clinic several times, and I'm trying to remember. I may have met her sister, I'm not going to remember it, and I may be really embarrassed. I don't think I did.
What did you think of her brother?
I thought he was a cool little guy. Typical relationship between a brother and sister, each trying to annoy the other, and, but a very loving, caring family. He was real supportive, and he was there with her getting some treatments. And I think that's good for brothers and sisters, because I do think that many times when the child with cancer is going through treatment, they get a lot of attention. And they're getting a lot of support from the doctors and nurses at the hospital. But the brother and sister may be stuck at home, wondering what's going on, or being left out, or just, kind of feeling, well, she's getting all the attention, I don't get anything anymore. So I think they get kind of a shaft a little bit going through this. But her brother seemed to do pretty well, and they seemed to get along really well, and it was good for him to come to be able to see what she was going through and help support her.
Okay. Do you guys have any questions?
I think we got all we...
Do you want to say anything else?
Please.
Any useful information that we just hadn't covered?
I think probably the most important thing that I think most people don't know about childhood cancer is that most kids who get cancer are cured. I think when most people hear the word cancer, they immediately think that someone's going to die. That's the normal reaction that people have, and in some cases that's going to happen. But in most cases with kids, the kids are going to be cured. It takes a lot of hard work. It's not pleasant. Sometimes Stephanie was very fortunate to have a type of cancer. But she had a kind of cancer that didn't require a long time of treatment. Some of the cancers that kids get, they need treatment for 2.5 years.
Okay.
Or a whole year.
How long have you been working with children with cancer?
I've been working with kids with cancer since 1978.
Okay. Have you always used chemotherapy and radiation, or did you use any other?
Well, there are 5 main types of treatments for cancer. There's the very first treatment for cancer was surgery. And Stephanie had surgery, but just to find out what kind of cancer she had, she was called a biopsy. And she also had surgery to place a special device to give her chemotherapy called FORT. Then the second type of treatment to come along was the radiation therapy. And in fact, Hodgkin's lymphoma, a long time ago, was only treated with radiation therapy. And in some cases in adults, that might be the treatment that they use. But there's a lot more side effects for kids if we use radiation therapy. So we usually combine it so we don't have to use it twice. Third type is chemotherapy. She had all 3 of those. The fourth type is a thing called biological response modifiers, and we use those treatments. She didn't receive any of those. And then the fifth type is, although she may have had some nicotine. Did you talk to you about shots that she had to take at one point?
Talked about needles.
Needles, yeah, she had a lot of needles. That's a big, huge thing. I'm trying to think if she ever had to have the Neupogen. I think she did, because I think she had some low blood count. And she had to have this medicine to help her body recover from the side effects of the chemotherapy quickly. But, so that's a biological response out of it. And then the last one is bone marrow transplant. Unfortunately, Stephanie wouldn't need to do that. Although some kids who have Hodgkin's lymphoma, if they have recurrent disease, if it comes back and or it's really spread throughout the body, they might be treated with a bone marrow transplant.
Okay, I'm not sure, but could you maybe like rank these in the order that they were most effective or overall have seemed to treat the cancer the best?
You know what? It depends on the cancer. There are some cancers, like there are a lot of adult cancers that all you need is surgery, and that's the best treatment for a certain kind of adult cancer, like adults that get bowel cancer. Cutting it out may be the only thing that's needed. Or there's certain type of brain tumor that all they need to do is they need to be cut out. But then there are other cancers that's not enough, because cells have spread from the original tumor that you cut out around the rest of the body. And so they need treatment that's going to go everywhere the blood goes. Radiation therapy is used with a lot of cancers, but it's not the only treatment. Usually what works best, and especially in children, is when we combine the chemotherapy and radiation therapy and surgery and biological response sometimes in the bone marrow transplant. It all depends on the type of cancer, how much of it there is, and sometimes the radiation.
Now, do you do chemotherapy always before radiation, or?
Depends. Again, it depends. I think I'm going to take a couple steps back, and I'll tell you how is it that we know how to treat cancer? That's a good question. You know that, when you think about, how do we know that what we gave Stephanie is the best treatment? And the way we know that is in childhood cancer. This happened in the late 1950s, is that the pediatric cancer specialists knew that because childhood cancer, the cancer that kids get, is very rare. Like in adults, there's about 200,000 cases a year. There's only about 10 to 12, maybe 10,000 or a little bit more in children. And so because it's so rare, they knew that unless they got together and developed these research studies to find out what is the most effective treatment, that we wouldn't cure enough kids. And so in the late 50s and 60s, they started doing this. And over the decades since, most of the kids with cancer are treated on these research studies. And it's because they've built this treatment one on top of the other and have studied it very carefully that we know the treatment that we prescribed for Stephanie and the protocol that she'd agreed to participate in was the best treatment for her. In fact, the treatment protocol that she got would be the same treatment protocol that would be offered to a kid anywhere in the country, because we all belong to this one group, and this network of cancer research studies spreads throughout the country. In fact, all of North America and Canada. And so it's through that concentrated effort in research and being on clinical trials that really makes a big difference. And these are all funded by federal tax dollars, the National Cancer Institute, and I think it's a really good use of our taxes.
Definitely.
Wow, I gotta take a break because my leg won't stop shaking.
Okay.
Sure.
Both of them will decide later. Oh, you're filming right now. Push the right.
I'm recording it.
patient stuff.
Okay, I'll do that.
Get another stuff while you concentrate on that.
Room where the patient gets their radiation therapy. This is a treatment table that they lie on, and then the radioactive source comes down out of this machine. It only takes a very short time, just a few seconds really. But the beam that comes down out of there is based from a radioactive source that's inside there. And then each patient gets their own, they call it a prescription for radiation. And so they have to, our physicists figure out what dose of radiation they get and how long the treatment is and how deep the radiation has to go to hit the tumor. Now what they want to do is just get the tumor and not the surrounding tissue, so they have to find ways to block out the radiation to the places they don't want to treat. So this table can go up and down and move around so that the patient is the right distance away from the radioactive source. The way radiation works is the closer you are to it, the higher the doses that you get. And then you want to look at some of these blocks over here. One of the ways they block out radiation to the areas they don't want to treat is they make these are lead blocks, so that if the radiation was coming down towards the patient here, when it hit one of these blocks, it would block the beam from hitting that part of the patient. So each patient has their own set of blocks so that the radiation only goes where they want it to go. Then there's another whole room that you don't see here where the technicians sit with lots of computers and buttons and such to make sure that the patient gets the right prescription. The patient has to be in this room alone so that nobody else gets exposed to radiation. So that's a little scary sometimes. So there are video cameras in here and monitors and speaker system so that the patient can always be heard and seen the entire time they're in here. So if there was any problem, the technician would know immediately and would just stop the treatment and come right in and help that patient.
What's that?
This is one of the, I don't know what this is.
Okay, why don't you say the thing about the monitors so the doctor can come in again, because that was in the way.
The cameras and stuff up in the corner.
Say like they have monitors in here, but nobody else is allowed to be in here. Because like while you were saying
okay,
that little thing, yeah, that little thing.
Someplace else?
Yeah.
It's for the table. But I don't know. I better not say anything.
Okay.
Okay. See this camera up there? So is that what you want?
The camera right there.
You can show the cameras while you say cameras.
While the patient is being treated, they have to be alone in the room because they are the only one that should be exposed to the radiation. Nobody else should be exposed to radiation. So the patient is in the room by themselves, so that can be kind of scary. So to make sure that they are safe and that we see if there's any problem, there are cameras in the room and speaker systems so that at all times the patient is visible to the technician and the staff, and they can tell us if they need anything, and we can talk to them as well. So the treatment itself, once they're set up and on the table and ready to go, which the staff and the technicians help with that, once they're set up and ready to go, the treatment only takes a really short second, and then we come back in. So it's only a really short time that they're by themselves in here. But for some people, that's scary to be in a big room with all this equipment because it makes noises and clicks, and so it's important that they...
Hopefully, you will never need to go to a hospital, but unfortunately, approximately 8,400 children in the United States alone will have to go to a hospital similar to this one for the treatment of cancer.
Stop.
Who the hell is stop?
So that the radiation does not go outside of this room.
Okay. Got it?
You get shots of it over in the corner, or is there anything in between over there? Just like doing like.
Okay, this is the History Day project of...
Hopefully you will never need to go to a hospital, but unfortunately, approximately 8,400 children in the United States alone will have to come to a hospital similar to this one for the treatment of cancer.
This isn't working.
Oh, there's a monitor.
Okay, go ahead.
Hey, this is the simulation room. Oh, I'm sorry. If I got you to text me, I think. Before I get the first radiation treatment.
Hi, that's Rachel's mom, Kathy, and she's explaining the thingamabobber, the simulation table, and I'm just checking the audio dubbing. Thanks.
X-ray machine. The patient lies down here. You can see they put their head, headrest there. And the simulation appointment that they have is a really long appointment. It can take a few hours for them to get all their calculations right. But once they're finished, then they have their prescription, and they know how they're going to make the blocks to block out the radiation so it doesn't go to the tissues in the body they don't want it to go to. So after this session, then they would, the next time they come, they would go to the real linear accelerator machine that was in the other room and get their real treatment based on the prescription that
You're recording now. I faded in.
You know how.
Hello? Can you hear me on the TV? That means it's working. And this is all you have to do, and you just talk over the video and it records over what's already there. That's not, no, that's testing. It's not the real thing. We
We would like to dedicate this to all the children who have to experience the pain and suffering brought forth by cancer, and to their families who helped them through it. We would like to dedicate this to all the children who have to experience the pain and suffering brought forth by cancer, and to their families who helped them through it.
He will never need to go to a hospital, but unfortunately, approximately 8,400 children in the United States alone will have to come to a hospital.
Hopefully you will never need to go to a hospital, but unfortunately approximately 8,400 children in the U.S. alone will have to come to a hospital similar to this one for the treatment of cancer.
August 6th, when I had my biopsy for the lump that I found in my neck, so that's when I first found out. Okay, what kind of cancer did you find out you had? Hodgkin's lymphoma.
This is Stephanie, and she was diagnosed with Hodgkin's lymphoma in the summer of the year 2000 when she was 13 years old.
It's just like a basic type of cancer. It's just for different kind of cancers that found in different types of the body. And this one was found in my lymph nodes, which is like all around your neck areas and down your lymph nodes in your body. But this one was
If you are a child with cancer, then this is someone you should meet.
Sure. This is Kathy Patterson Kelly, and I am a clinical nurse specialist who works with children with cancer and blood disorders. And a clinical nurse specialist is a nurse who has gotten a master's degree in nursing and has specialized in a specific area of treatment. And my area of specialty is prostate cancer and breast cancer.
Okay, what can you tell us about Hodgkin's lymphoma?
Hodgkin's lymphoma is a cancer that occurs in children and adults as well. It is probably about the third or fourth most common type of cancer that children get. The lymphoma is about the third most common. And it's a cancer of the lymph gland. It was actually discovered many years ago by Dr. Hodgkin. Children who get Hodgkin's lymphoma usually have a history of having a lump or an enlarged lymph node. It just doesn't go away. It doesn't necessarily hurt, but it just doesn't go away and sometimes keeps it there.
Okay, what's your lymph node?
A lymph node. Now, the lymphatic system is the part of your body that is one of the responsibilities for fighting off infection. When you get like a really bad cold or a sore throat or strep throat, you'll notice sometimes that you may get knots in your neck and you can feel that.
Okay, what kind of treatments did you have at first? I had chemo first. And they were just like basically some weeks they had an all day thing and it also went all week and then some days they had just 1 day. Okay, and are you
Hodgkin's lymphoma is treated with two main forms of treatment. We use both chemotherapy and radiation therapy to treat Hodgkin's lymphoma. And Stephanie will keep both of them.
Okay, would you explain what chemotherapy is?
Chemotherapy is an anti-cancer treatment. It is chemicals or drugs that are used to fight the cancer. And the way these drugs work is that, unfortunately, we're not smart enough in this day and time to have drugs that are specific to they kill Hodgkin's lymphoma. We're not that smart yet. So what we have is this whole big group of drugs or chemicals that kill rapidly dividing cells. And cancer is rapidly dividing cells, and so these chemotherapy drugs go after rapidly dividing cells. And it's the normal cells in the body that you see side effects from because they also kill some of the bad cells. All the same.
Okay, what are some of the negative effects of chemotherapy?
The main side effects, and this all goes back to this killing rapidly dividing cells. The most common side effect that we see with most all the chemotherapy is that we see effects on the bone marrow or the blood producing organ, because we're always making new blood in our body. We see effects on the cells that line the gastrointestinal tract, the mouth, throat, stomach, gut, all the way up to the anus. And that's where we see side effects like nausea, vomiting, diarrhea, or mouth sores. And the third cell that's always dividing in our body is our hair. And we have we're constantly going hair, and that's why we see hair loss and lots of chemotherapy.
Does chemo help you more or the radiation? Basically the chemo helped me more than the radiation. So based on like the scans that I got and everything like that, the chemo made it die and the radiation made it so that it would shrink more. Okay.
Radiation therapy is actually high energy particles that are made in this special machine called a linear accelerator, and they're kind of blasted through, if you will. I mean, so I don't know exactly how it works. It's an amazing thing. But they're these high energy particles that are directed into the cancer. And once they get in the cancer cells, they affect how the cells, the whole electronic makeup of the work, not electronic, but they actually will displace electrons, and then when the cells go to divide, they'll die. And so it's pretty interesting how it actually kills the cancer cells.
Now, what effects does that have?
Now, radiation therapy has similar effects to chemotherapy in that it does affect these rapidly dividing cells. It also affects the normal cells that are in the pathway of the radiation therapy. Most commonly, kids may get, and the radiation therapy side effects are only where you actually point the radiation. So, like if you get radiation therapy to the neck, which is where Stephanie got neck and chest, where Stephanie got most of her radiation, you're not going to have problems with hair loss from radiation because you don't have radiation to the head. Or she probably didn't have a lot of trouble with nausea and vomiting because it wasn't in her belly. But a lot of times the skin is affected and they can get kind of like a suntan or a sunburn where as the cells go, as the particles go through the skin, they actually destroy some of the skin cells and it's manifested in this kind of tanned area or burned area. And then when the cells like go through or scatter to the esophagus or the throat, sometimes people will get sore throat. If they go through the mouth, sometimes they can get frozen in the mouth or affect your teeth. In the long term, what happens with radiation therapy is that it affects how the bones and the muscles grow. So that in the area where you've got radiation, say for example, when Stephanie grows a little bit more, that area may not grow as fast as the other area. So one may notice a slight difference in the size of one neck and the other side. And then the other one that we'll be watching out more carefully for Stephanie is there was some radiation therapy to her thyroid gland. And so sometimes the thyroid function can be affected much later on.
This is a treatment table that they lie on, and then the radioactive source comes down out of this machine. It only takes a very short time, just a few seconds really. The beam that comes down out of there is made from a radioactive source that's inside there. And then each patient gets their own, they call it a prescription for radiation. And so they have to, our physicists figure out what dose of radiation they get and how long the treatment is and how deep the radiation has to go to hit the tumor. And what they want to do is just get the tumor and not the surrounding tissue, so they have to find ways to block out the radiation that they don't want to treat. So this table can go up and down and move around so that the patient is the right distance away from the radioactive source. The way radiation works is the closer you are to it, the higher the dose. Block out radiation to the areas where you don't want to treat is they make these are lead blocks. So that if the radiation was coming down towards the patient here, when it hit one of these blocks, it would block the beam from hitting that part of the.
The history of cancer treatment includes information about chemotherapy and radiation therapy. The action of chemotherapy was discovered from medical observations of soldiers who were exposed to sulfur mustard gas in World War I due to chemical warfare. The United States Army was the first organization to discover the anti-cancer chemical. Later, Dr. Sidney Farber described a drug that blocked two chemical reactions needed for duplication of DNA. This drug, aminopterin, blocked the duplication of cancer cells. In 1896, Wilhelm Conrad Röntgen discovered the X-ray, and 3 years later, this radiation was used to treat cancer. Over the past several years, research has led to many advances in the use of chemotherapy and radiation therapy, both for cancer treatment as well as for controlling treatment-related side effects.
The most important thing that I think most people don't know about childhood cancer is that most kids who get cancer are cured. I think when most people hear the word cancer, they immediately think that someone's going to die. I think that's the normal reaction that people have. And in some cases, that's going to happen. But in most cases with kids, the kids are going to be fading in.
We would like to dedicate this to all the children who have to experience the pain and suffering brought forth by cancer, and to their families who helped them through it.